Breast implants, confidence at a high cost. Breast augmentation has become the most popular cosmetic surgical procedure in the United States. It accounts for 16.5% of all plastic surgery procedures for women, with an estimated 1 in 26 women now having implants. For several decades, breast implants have been marketed as safe, glamorous, and empowering. Advertisements promise boosted confidence, better body image, femininity, and social approval. But beneath the glamour lies a much darker truth. Tens of thousands of women worldwide have reported debilitating health problems linked to their implants. This condition, known broadly as breast implant illness, has contributed to a 47% increase in implant removals. Breast implants entered the United States market in the 1960s. The beauty industry, fueled by Hollywood and advertising, equated larger breasts with desirability, success, and status. Today, social media has amplified these pressures. Filtered influencers, celebrities, and reality TV stars often showcase perfect bodies, normalizing surgical enhancement. Breast augmentation ranks among the top 5 cosmetic surgeries in the US. Recent statistics: 80% of breast implant surgeries are for cosmetic reasons. 20% are reconstructive, often after mastectomy. 400,000 women in the United States undergo breast augmentation or reconstruction each year. Over 3.6 million women currently have implants. The global breast implant market is valued at over $2 billion annually. Breast implant illness, BII, encompasses a variety of symptoms that don't affect every woman the same way. Thousands have reported systemic issues, chronic fatigue, inflammation, autoimmune conditions, hormonal imbalances, physical symptoms, hair loss, skin rashes, joint and muscle pain, respiratory problems, neurological effects, brain fog, memory issues, anxiety, depression, immune system disruption, recurring infections, reactivation of dormant viruses like Epstein-Barr. BII isn't officially recognized by doctors or the FDA as a medical condition. Women report seeing dozens of specialists without receiving proper diagnosis or treatment, with many doctors dismissing their symptoms as psychological. Implants, whether silicone or saline, are encased in shells containing dozens of chemicals that can leach into the surrounding tissue. These include arsenic, tin, used as a curing catalyst, methyl ethyl ketone, a solvent also used in automotive work, heavy metals like platinum, industrial-grade silicones. Elevated levels of these substances in the blood can lead to neurological symptoms and systemic illness. Capsular contracture. The body forms scar tissue around any foreign object. This capsule can harden and compress the implant, causing pain and deformity. Grades range from undetectable to severely visible and painful. Structural damage. Implants, particularly when placed under the pectoral muscle, can cause rib deformation and flattening, muscle damage and thinning, nerve damage leading to numbness or chronic pain, breast tissue atrophy from continuous pressure. Silicone migration. Even intact implants can leak silicone through gel bleed, with silicone found in lymph nodes, liver, spleen, and lungs years after implantation. Breast implant-associated anaplastic large cell lymphoma. Certain breast implants have been linked to a rare cancer affecting immune system cells. Other factors, linked primarily to textured implants, For some, mortality rates reach 50% within 6 months. Despite global recalls, thousands of women still have them in their bodies. Lymphatic system. Breast implants can significantly impact lymphatic function by acting as physical barriers to natural fluid flow, causing stagnant lymphatic drainage, reduced oxygen flow to the brain, compromised immune function, and accelerated aging due to toxin accumulation. Implant rupture. Silicone leaks can silently spread through the body. Installation complications. Modern breast augmentation typically involves placement under the pectoral muscle, requiring muscle detachment from the ribs. Potential lowering of the natural breast fold. Risk of asymmetry and nerve damage. Multiple implant size trials during surgery, increasing contamination risk. Removal complexities. Surprisingly, implant removal is far more complex than installation and is further complicated by a lack of expertise in proper explantation techniques. Capsule removal from ribs requires careful surgical technique. Breast reshaping without volume loss demands advanced skills. Natural fold restoration may be necessary. Risk of leaving toxic scar tissue if incomplete removal occurs. Despite decades of patient reports, the FDA and manufacturers have minimized the risks. The FDA hid over 446,000 adverse event reports related to implants. Investigations uncovered 6.8 million additional hidden reports across various medical devices. Many safety studies are industry-funded, designed to downplay harms. And the FDA has failed to mandate comprehensive safety studies. The breast implant industry mirrors pharmaceutical industry practices. Plastic surgeons conducting safety studies often have financial ties to manufacturers. Medical journals may publish biased research from industry-funded authors. The same surgeons promoting recalled implants now advocate for new technologies. Cultural pressure often plays a huge role in women's decisions. Many feel implants are necessary for relationships, careers, or self-worth. But thousands of women found that when they became sick enough, vanity quickly gave way to survival. Women have reported dramatic improvements after proper explantation. Immediate reduction in inflammation, improved energy and cognitive function, resolution of autoimmune symptoms, and enhanced overall quality of life. Some women require additional treatment for heavy metal toxicity, lingering infections, or autoimmune conditions triggered by their implants. Some follow-up support systems include detoxing with infrared saunas, lymphatic drainage, and gentle detox therapies, nutrition, anti-inflammatory diet, and gut repair protocols, functional medicine, naturopathy, energy-based therapy to rebalance the body. If you have implants, watch for changes in breast appearance, unexplained symptoms, or declining health. Find surgeons experienced in explantation who understand BII and can perform complete capsule removal. Get multiple opinions to broaden your options. Seek testing for heavy metals and underlying infections. And monitor your health closely, even if you feel fine. If you are considering implants, research thoroughly and understand that implants require lifetime maintenance with replacement every 10 to 12 years. Select board-certified experienced plastic surgeons with extensive experience in both augmentation and explantation. Evaluate whether the risks align with personal values and health priorities. Consider alternatives such as fat transfer or external prosthetics. Get the FDA's black box warning checklist. Breast implants may improve psychological benefits for some. However, women are not told the full story about their choice. From chemical exposure to autoimmune disease to cancer, the dangers are real and often ignored by those profiting from a lucrative industry. Your body is not a trend. Your health is priceless. The beauty of a woman is not in the clothes she wears, the figure that she carries, or the way she combs her hair. The beauty of a woman must be seen from in her eyes, because that is the doorway to her heart, the place where love resides. From Audrey Hepburn. Hi, I'm Ellen McCurdy, and if you enjoyed my free digital report, The Big Three Things That Are Harming You and You Don't Even Know It, you might want to get my ebook, 12 Dangers to Your Best Life and How to Fix Them. It comes with several bonuses, including wall art, a tracker, and another digital report on bladder leaks. The link will be in the description, or you can go to my website, triumphandgrace.com. Thank you. Talk to you later.